Hello, I'm Dr. Kaisar, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yeah, doctor. I'm Mary, and I am 32 years old.
Is it okay if I call you Mary?
Yeah, it's fine.
Uh, Mary, first of all, I apologize that my consultant is away due to some unavoidable circumstances. Is it okay if I continue the conversation on her behalf and later on I will fix your appointment with her next time?
Yeah, okay.
Thank you, Mary. Mary, I understand from the GP letter that you are 36 weeks pregnant and today you want to discuss the delivery plan and as you have a 4-degree tear in the previous pregnancy, right?
Yeah, doctor.
Surely I will address your concerns in a while, but before that, is it okay if I ask you a couple of questions to know more about you?
Yeah, okay, doctor.
Mary, do you have any more concerns and expectations from today's meeting?
Yeah, doctor. I'm just really like afraid. How shall I go about? Because last time I had a bad tear, and this time I just want to know how would I deliver, and will it be safe for me?
I am sorry to hear that you have a tear, but don't worry, we're all here to help you and support you. And could you tell me more about this pregnancy? How is this pregnancy going so far?
Yeah, doctor, it's going very well. I don't have any gross issues. I'm 36 weeks now, and I had the bloods and the scans all are normal. Nobody has shown any concern about it. It's just that this place is new for me, and we have just shifted, so that's why I've come for the first time to you. I went to the GP and he said that I need to talk.
Don't worry, Mary, we are all here. So, have you named the baby?
Yeah, it's Maria.
Oh, what a lovely name. How is Maya doing inside?
Yeah, I think she's fine.
Oh, good to
Thank
hear that. So, Maya, I can see that this you have one pregnancy. Apart from that, any other pregnancy or any other kid you have?
No, doctor. This is my second one.
Okay, okay. Mary, regarding that Maya's pregnancy at that time, could you tell me more about that pregnancy and about the delivery? What happened exactly?
Um, Actually, doctor, somehow I think doctors there they gave me more doses of medicine, and I quickly delivered. After after giving the doses, my pains increased to quite a lot, and then it was suddenly some nurses, they were new also, I think they were new, and they started screaming that you have to push, baby's heartbeat is going down. So I was really so apprehensive, but I was so drowsy because they gave me some pain relief, and I was not able to push properly. And then they applied some, we don't know, that cup kind of a thing on the baby's head, and baby
Mm-hmm.
came out. And that after that, doctor came and they said that I had a tear and they need to repair that. And I was taken to the OT instantly, and it was really like a nightmare to me.
Sorry to hear all that you have gone through a lot, but don't worry. In this pregnancy delivery, we will take all the precautions so that you will reach all the expectations. So, just want to know, have you been given post-delivery instructions after that?
No, they just told me to take the sitz bath, and that I was doing for quite a long time, and that's it.
And
Nothing else.
have you been seen 6 to 12 weeks after delivery in the specialist clinic?
No, doctor.
Okay. And anytime, do you have any symptoms like passage of wind or stools without your intention?
No, doctor. Initially, it was there for 1 or 2 months. I was really getting embarrassed with the winds, but after that, it went away.
Okay, that is good. So, I would like to check your delivery notes with your permission. Would that be okay for you?
Yeah, okay.
Okay. So, Mary, could you tell me, do you have any medical condition for which you are seeing your GP?
No, doctor.
Any surgery in the tummy or down below apart from the surgery?
No, no,
Any family history of concern you want to share with me?
no, doctor.
Any medications you are on?
No. I just have
Uh,
just having the regular vitamins. That's all.
okay, okay. And any allergies you are aware of?
No, doctor.
Don't mind me asking you, do you smoke?
No,
Take alcohol?
no, doctor. Nothing in the
Any recreational
pregnancy.
drug for fun?
No.
Okay, that's good. And Mary, I can see that you are a scientist, right?
Yeah.
Okay, and how is the support at home?
My partner is very supportive.
Okay, that is good. And are you aware about your height weight ratio?
Yes, doctor. I think it is 26 now.
Okay, and what about your blood group?
Be positive.
Any reservation for blood transfusion if required?
No.
Okay, Mary, have you ever felt down, depressed, or hopeless from the past few weeks?
No.
Thank you for sharing all the information with me. Anything else you want to add?
No, doctor. What I was thinking that as I had the this tear last time, bad tear, is it safe for me
Yes.
to go for cesarean section as I don't want to go. I don't want the tear again. I just really don't want. So if you can offer me a cesarean section um, for the delivery.
Mary, as every woman have the right to choose when, where, and how to deliver, I will give you the pros and cons of vaginal delivery and cesarean section, and whatever you choose at the end, we will help you and support you in that. Would that be okay?
Okay.
So before that, Mary, I would like to examine you in the presence of chaperone to check your heart rate, pulse, blood pressure, and then I would like to examine your tummy to see how the Maya is doing. Would that be okay?
Yeah.
Okay, thank you, Mary. So, Mary, coming to the concern of the delivery, whether to go for the vaginal delivery or cesarean section. So, regarding the vaginal delivery, as it is safer, it is free from the anesthesia complications, bleeding, infection later on, and also the in future pregnancy, the complications like placental complications or dying of the baby in the womb in future pregnancy, that will be less. But yes, definitely in the con is that in 5 to 7 out of 100 women may have a repeat tear as well. But Mary, we will take all the precautions. So we will take all the measures to minimize this risk, like perineal protection during the delivery, or perineal massage and warm compressions. These are the measures through which we can minimize the chances of having this tear again. Are you with me?
Mm-hmm. Yeah.
Yes. Regarding the cesarean section, Mary, as it is a surgery, it is definitely it is having anesthesia complications, placental complications in future pregnancy. After delivery, infection chances will be there, bleeding chances will be more. But the pros is that yes, definitely it is free of having. I mean, there will be no chance of having the repeat tear. Okay, Mary.
Mm, okay.
Mary, these are the things. So, what do you think now? What do you think want to go for?
Okay. So, but you're saying that the risk of tear is still there. So, like, is it,
Yes,
will
it
it,
is.
if it
It
happens,
is not.
then what, how will we manage that? Again, I have to
Yes.
suffer a lot.
Uh, Mary, we will take all the measures to reduce the chances of this tear again. But in case if it happens, then we will take all the measures to stitch it back as you are already knowing it. Then we will give you certain post delivery instructions. Then you will be seen again at 6 to 12 weeks in the specialist clinic. And Mary, around 6 to 80 out of 100 women will be asymptomatic at the end of the 12 month, at the end of the 1 year after that year. Okay, Mary.
Okay. Yeah.
So, Mary, you can take your time. You can.
Time over there.
Okay. Okay, ma'am.
You finished it almost, no? So, but in the last station itself, I've told you to give her the written information and
At the
refer her
beginning, ma'am, I forget.
back.
I forget, ma'am.
Okay.
Please.
No worries. When we'll practice regularly, you will get that habit. Okay.
Yes, ma'am.
And yeah, that uh, you have done really well. Again, I'm happy that I already have the students who know many things. So that's great. You know the station, you know the approach, you know how to do it. You're Amna.
No, no, I'm Kassir, ma'am.
You're Kesser. Okay. So
Yes, ma'am.
Kesser, your approach was really good, and
Thank you, ma'am.
you know how to go about the station. Certain finishing things you require. That's it. So
Yes,
I think next May exam will be yours, both of you, Rekha and
inshallah.
Kesar. Yeah. So you've done really well. I'm happy. So
Thank you, ma'am.
if I'm telling you this, that means you're you're really good. I don't butter people at all. Okay, and I really pull you back so much that some of my friends they really hate me for it. But it's my nature. I can't butter unnecessarily. You are doing well. So in this, what you have done is I found a little hesitation in the start of the station. Okay, just shed off your hesitation first of all. You are a full-blown consultant. You know how to take care of the patient in your countries or at your places, right? And this is mere
Yes.
an exam. You have to show your clinical skills and communication skills, and we are very good in that. We all. So just remove the hesitation, start confidently, and I'll be doing the station, and I'll be tell you automatically will get to know that where you were lacking. Okay, otherwise you have covered everything. I don't have anything to say. In some history points, yes, you left some important points so that you can, at least if I did not ask you, because you did not ask me in the history few points, so that's why I didn't ask you why this happened to me last time. Nobody has explained me. This question you will get. So for that, you have to check for the risk factors in the last pregnancy. Okay,
Okay,
introduction
ma'am.
you did it well. Confirm the purpose that I can see that you're 36 weeks here and we are here to decide for your pregnancy plan and delivery plan. Yeah, I'm new to this place and I want that. Okay, so consultant, you said that it's not consultant is not available. I will be taking your consult. Though I am little unhappy with this line because she never asked for consultant. If she does not ask, why do you, in this scenario as well, it is not written that she is here to show to the consultant. She's here for the consult. So you can also give the consult. But then in the end, they have mentioned that consultant is out. So if you speak that consultant is away, that's okay. But I found this line unnecessary here. Then in the agenda, you should always ask for the open question first before making the agenda. As you already said, I will be asking you few questions. Is that okay? Then you asked me, do you have any concern? Then I asked you the concern. Either you solve it or you make the agenda in the last. Yeah. Like first you will ask any concerns you have. No, I can see you are here for this. Is that right? Yeah. Any other concerns you have? Yeah, I want to know about my delivery thing and all. All right. Then will that be fine if I ask you few more questions and then I come to your concerns and clear that and we make a suitable pregnancy plan for you? What do you think? Yeah, okay. So, can you tell me more about your tear? Oh, just one time say sorry and just be empathize with her with your non-verbal language. Oh, I'm sorry to hear that this complication has happened to you. She was blaming the doctor and the nursing staff. You don't have to defend, but you, in your language, you should not accept that it was a mistake. Okay, so just say, oh, I'm sorry to hear that this complication has happened to you. um may I ask, was it a term delivery? What was the weight of the baby? Was there any instrument used? She already told that it was a vacuum cup. Was it a long labor? Okay, in so she said no, I labored too quickly. So maybe do you have any idea of the hours of labor? So if she says it was in 2 3 hours, then it is a precipitate labor. Okay, noted. So was the tear diagnosed immediately? Okay. Was there any support for you? As I can see, this was really too much to take for a new mom. So, was there anybody to support you and help you at that time? Did you have any leak, any wind passage, any bowel opening that you asked without your intentions? That was okay. Any physiotherapy you've undergone? Did you meet the specialist gut doctor after the delivery? Okay, so that's it. Any present symptoms? She said I had leak in first 2 months and after that it was relieved, means she does not have any present symptoms. Okay, so now history of present pregnancy, this was the past complaints. And then the present, you have asked all the risk factors in the past complaints. Now and she has two risk factors. One is precipitate labor, one is vacuum. You didn't ask the baby weight, so we don't know about the big baby. um, and also, if she has symptoms, then if she didn't have physiotherapy and postnatal meet, then again the risk factor, more risk factors are there for the symptoms. Now, how far you stay from the hospital? Any bloods or scan concerns? She already said that nobody had any concerns. Okay. And you asked about how's Maya doing inside. I think you asked that only, right?
Yes, yes, ma'am.
So rather than doing, you can ask how is she kicking? Because doing you will be knowing, kicking she will be knowing, right? She only knows how she
Okay.
kicks. So how's she kicking? Okay, have you named the baby? All right. I never ask the name because I forget the name in the station during the station, and then I keep on saying baby, 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 and then it looks like little out of situational awareness that you have asked the name and you didn't repeat it at one time only. Maybe you're not interested in listening, so you can skip that. If you are good in that, you can do. It's a good communication skill. um, any problem during this pregnancy, any medical comorbidity or surgical, you asked. What are your future plans? They are very very important to ask. Okay,
Yes, ma'am.
because once
Okay.
we will be coming to you for the delivery counseling, so the mode of delivery will depend upon the future plans of the future pregnancies. If she want a cesarean, so you have to add a line that in future there will be a scar and the pregnancy will be a high risk pregnancy. Okay, so that you have to tell her. Medical and surgical comorbidity, drug allergies, you have asked everything. Then blood pressure, we will check your tummy to see the growth of the baby and the heart rate of the baby. Local examination, I want to, may I do your examination from down below area because in the presence of chaperone, if you'll allow. May means asking for itself. So in the presence of chaperone, may I do that? Okay. I just want to see the tear on the scar over there and what is the strength of the muscle, because the scar, the tear which happened last time, it involves the bowel opening. So I just want to check the strength. If she has symptoms, then check the muscle strength, anal sphincter strength. Otherwise, if she does not have symptoms, don't check for the muscle strength. Just see the scar. That's it. What was her name? Mary. Mary, as you know, we really can't predict the tears. There are some risk factors which make you prone for the tears, as in the last pregnancy. Um, there was a cup, the labor was too quick. So, those can be the things that put you at risk. But in this pregnancy, there is no risk as such apart from the tear that had happened already and this scar. So generally, the recurrence or having it back again is 5 out of 100 risk for the normal vaginal delivery. So options are there for you, like if the second time you're getting delivered, so delivery will be easy for you, vaginal delivery, and we don't see any other risk factor as well. So we can book you in consultant unit, and multidisciplinary team of doctor means team of doctor is okay, will be there for you to support you. She is asymptomatic, so you can first give her the vaginal delivery option, or you have asked her as well that what do you want? I want a cesarean section. Is there any specific concern? I don't want to have this again. Okay, all right. So, what, Mary, if I told you pros and cons of both of the things, and then you can get the more clarity about choosing your option, choosing what's good for you, then she'll say okay. Or if she is adamant, no, I will go for normal delivery and she is symptomatic, then you can say, Mary, your symptoms may worsen after the delivery, normal delivery, if she is symptomatic, mind it, right? So we recommend you to have a cesarean section. But if she still says, no, I want to have a normal delivery, then you continue according to that. That scenario also I'll tell you. But here, as she is asking for cesarean section, you can tell her about the pros and cons of both. So, Mary, starting from the vaginal birth, if you go for that, it will be an easy delivery this time. And one-to-one support will be provided to you. There will be a specialist midwife with you to take care, and we will give warm compressions, perineal support when head delivers, and cut will be given if required, as according to research it does not reduce the incidence of tear. Physiotherapy will be given provided to you afterwards, and maybe from now onwards, like from 35 weeks onwards, we advise you to do the massage of the lower down area, that's the perineum, yeah, the area between the vagina and the bowel opening. For that area you can do the massage with simple olive oil, or any oil can be used. That can be done by you, or your partner can help you in that. I'll ask my nurse if you're willing for that. Okay, here I have written delivery before, because when I was making this key, I didn't realize that she can ask for cesarean. I thought this station is about make my management plan, what will be suitable for me. So I wrote delivery first and cesarean in the last. But if she asks that I want cesarean section, so you talk about cesarean first and then delivery. Shall I tell you about the benefits of the delivery and how can we reduce the risk of tear and how can we go about it? If you are thinking about that, what do you think? So she'll tell you, okay, you tell me that also. Yeah. So in that you have to include 6 weeks postnatal visit also to check any leak or any symptoms if you'll be having. We will examine you, and team of doctors like gut doctor also will be involved. So he can also examine you. And if she want LSCS, then yeah, you told so many things. Risk of dying, it's already very less. So just say that as you are willing for future pregnancies, then, and if you have cesarean section, then there are risk of stuck after births and heavy bleeding and many complications in future pregnancy, which we really have to take care, and the pregnancy become high risk. And for this pregnancy, it puts you at increased risk of bleeding and infection, though there will be no risk of tear and any symptom afterward. But there are other certain risks which you should be aware about. Okay?
Yes, ma'am.
Uh, yeah. If symptomatic, offer LSCS. If wants NVD, then tell her that leak may aggravate. All of the precautions we'll take, plus colorectal surgical opinion between 4 to 6 weeks after delivery. Give her leaflets, give her and tell the GP. Okay?
Yes, ma'am. Thank you, ma'am.
Yeah. Any questions? You can't. Who can't
Ma'am,
see the slide?
at the end we have to tell her the warning signs as well, right, ma'am? Because
Um,
she's 36 weeks. Is it
yeah.
necessary?
Warning signs. Warning signs. It
Uh,
is good for telling it to everyone. I have
um,
spoken in every case. I have talked about red flags. I have talked about warning signs. I always tell, I have, in my own exam, I'm telling you, I have cleared it in first attempt and I got 75% marks. But I have finished all my stations in 9 minutes. And whatever they used to talk, I used to listen, and then I used to give them advice, and very quick advice along with all the buzzwords. So, like 36 week shares, you have asked very right. We will say that, okay, but so now you are approaching term. If you have any bleeding, any pain, or leaking, you need to rush to the emergency. We will have a joint meeting again. I will involve my consultant as also. I'll inform my consultant also. You and your partner can also join, and we will make a safer plan for you. So till then, you can read these leaflets. You can come up with any questions you have, and we can discuss it all over again. No need to decide now. Okay?
okay, ma'am.
No need to ask, have you decided? Have you opted for anything? Just tell her, no need to decide now.
Okay, ma'am.